Have you ever pondered the importance of rapid tracheal intubation in emergency situations? It's not exactly a topic that pops up at dinner parties, but its significance in the world of emergency medicine is monumental. Imagine this: you're in a high-stakes situation, a patient's life hanging in the balance. Their airway is compromised, and every second without oxygen is a step closer to severe brain damage, or worse, death. This is where rapid tracheal intubation steps into the spotlight. As a procedure that delivers oxygen directly to a patient's lungs, its role is paramount in ensuring the patient's survival. Often performed in critical care units, emergency departments, and during anesthesia, rapid tracheal intubation is a crucial skill for healthcare professionals. And here's why. In these instances, time is of the essence. A swift and accurate approach to intubation is vital to prevent hypoxia, a state where insufficient oxygen reaches the tissues, and other life-threatening complications such as cardiac arrest or brain damage. But it's not just about speed. Accuracy is equally important. An incorrectly placed tube can lead to a host of complications, including lung collapse and damage to the trachea. The interplay between speed and precision, therefore, is a delicate dance that requires comprehensive knowledge and a steady hand. Moreover, the process doesn't end with successful intubation. The subsequent management of the patient's airway and overall condition is just as critical. This involves monitoring the patient's vital signs, adjusting oxygen delivery, and being prepared to manage potential complications. So, as we delve deeper into the complexities of rapid tracheal intubation, we begin to grasp the gravity of this procedure. It's not just a technique, it's a lifeline, a beacon of hope in the direst of circumstances. The stakes are high, and the margin for error is slim. Understanding this, we see how vital mastering the induction techniques for rapid tracheal intubation becomes for healthcare professionals. For them, it's not just about saving a life. It's about doing it right, doing it fast, and ensuring the greatest chance of a positive outcome. The first step in the induction process involves pre-oxygenation. Now, what exactly is pre-oxygenation, you ask? In essence, pre-oxygenation is the act of increasing the oxygen reserves in your patient's lungs prior to intubation. This is a crucial step in preventing hypoxia, or the lack of sufficient oxygen in the body, during the procedure. Hypoxia, if not prevented, can lead to serious complications. It's like ensuring your car has enough fuel before embarking on a long journey. You wouldn't want to run out halfway, would you? Now let's talk about the methods of pre-oxygenation. The two most common methods are the use of a high-flow nasal cannula or a bag valve mask. These devices deliver a high concentration of oxygen, ensuring the lungs are adequately saturated. Let's start with the high-flow nasal cannula. This method is pretty straightforward. It involves placing a cannula, that's a thin tube, into the nostrils, which then delivers a high flow of oxygen directly into the patient's airway. This method is often favored for its comfort and ease of use. It's a bit like having a quiet, gentle breeze blowing into your nose, but that breeze is filled with life-saving oxygen. On the other hand, we have the bag valve mask. This device fits over the patient's mouth and nose, creating a seal that allows for the delivery of oxygen at a high concentration. It's a bit more hands-on than the nasal cannula, requiring a healthcare professional to hold the mask in place and manually control the flow of oxygen. It's like having your own personal oxygen bar, hand-delivered to your lungs. Now, the choice between these two methods will depend on various factors, such as the patient's comfort and the clinical scenario. But regardless of the method chosen, the end goal remains the same: to saturate the lungs with as much oxygen as possible, thus preventing hypoxia during intubation. Remember, an effective pre-oxygenation sets the stage for a successful rapid tracheal intubation. Once pre-oxygenation is complete, the next step involves the administration of induction agents. These agents are a crucial component in the process of rapid tracheal intubation. They are the chemical compounds that aid in rendering the patient unconscious, thereby facilitating the procedure. Let's dive a little deeper into the types of induction agents commonly used. First up, we have the barbiturates like thiopental and methohexital. Due to their rapid onset and short duration of action, they are often preferred. However, they can cause a decrease in blood pressure, so caution is required when used in patients with cardiovascular compromise. Next, we have propofol, a non-barbiturate hypnotic, loved for its quick onset and recovery times. It also provides a certain level of pain relief, but it's not all roses. Propofol can cause significant drops in blood pressure and should be used judiciously in hypertensive patients. Etomidate, another induction agent, is noted for its cardiovascular stability, making it a good choice for patients with unstable hemodynamics. However, it can suppress adrenal cortex function and cause involuntary muscle movements. Ketamine, a dissociative anesthetic, maintains cardiovascular stability and increases blood pressure, heart rate, and cardiac output. It's especially useful in patients with asthma or chronic obstructive pulmonary disease as it promotes bronchodilation. But it can increase intracranial pressure, so use it carefully in patients with head injuries. Dexmedetomidine is a sedative and analgesic with a unique mechanism of action. It provides sedation without respiratory depression, making it useful in certain scenarios. The choice of induction agent is not a one-size-fits-all solution. It's essential to consider the patient's overall health, their existing medical conditions, and the specific circumstances surrounding the need for intubation. The right induction agent can significantly influence the patient's response to intubation and their subsequent recovery. Remember, the right induction agent can make all the difference in the smoothness of the intubation process. Following the induction agents, neuromuscular blocking agents come into play. These agents are an essential component in the process of rapid tracheal intubation. They are used to relax the muscles, including those in the throat, to facilitate the insertion of the tracheal tube. There are two main types of neuromuscular blocking agents: depolarizing and non-depolarizing. Depolarizing agents such as succinylcholine work by mimicking the action of a neurotransmitter called acetylcholine. They bind to the receptors in the neuromuscular junction, causing the muscles to contract initially, then become relaxed. This is a very quick action, with the onset of muscle relaxation typically occurring within 1 minute of administration. Non-depolarizing agents, on the other hand, block the action of acetylcholine and prevent the muscle contraction from occurring. These include drugs like rocuronium and vecuronium. The onset of action for these agents is slower, usually within 2 to 3 minutes, but the duration of muscle relaxation is longer. The choice of which agent to use depends on a variety of factors. These include the patient's overall health, presence of any neuromuscular diseases, and potential for adverse reactions. For instance, succinylcholine, though fast-acting, can cause an increase in potassium levels in the blood, which could be dangerous for patients with certain conditions. On the other hand, non-depolarizing agents can cause a slower heart rate and potentially lower blood pressure, so they might not be the best choice for patients with heart disease. Another consideration is the duration of the procedure. For short procedures, a fast-acting agent like succinylcholine might be the best choice. While for longer procedures, a longer-lasting non-depolarizing agent might be more appropriate. In all cases, the selection and administration of neuromuscular blocking agents should be done by a skilled healthcare professional, with careful monitoring of the patient's vital signs and response to the medication. Neuromuscular blocking agents, when properly employed, ensure a safer and easier intubation. With the patient adequately sedated and paralyzed, we now move to the actual intubation. This is the moment when we navigate the endotracheal tube through the vocal cords and into the trachea. It's a critical step, requiring both precision and a deep understanding of the anatomy involved. To aid in this process, we use a tool called a laryngoscope. This is a device that helps us visualize the larynx, or the voice box, and guide the endotracheal tube. It comes in two main types: the direct laryngoscope, which gives a direct view of the vocal cords, and the video laryngoscope, which provides an indirect view via a small camera. Which one to use depends on the patient's condition and the healthcare provider's comfort and familiarity with the equipment. The laryngoscope is carefully inserted into the mouth, with the blade guided along the base of the tongue. It's crucial to avoid any unnecessary force that could potentially cause injury. Once the vocal cords come into view, the endotracheal tube is then advanced between them. But placing the tube is only half the battle. Confirming its correct placement is equally important. A misplaced tube can lead to serious complications such as a collapsed lung or inadequate ventilation. Therefore, we use a variety of methods to ensure the tube is in the right spot. These may include visual confirmation through the laryngoscope, feeling for equal chest expansion, and listening for equal breath sounds on both sides of the chest. More definitive methods involve the use of a device called a capnograph, which measures the amount of carbon dioxide in the exhaled air. It's worth noting that intubation is not a race. It's a procedure that demands skill, patience, and a steady hand. Mistakes can have severe consequences, so it's crucial to approach each step with care and consideration. Successful intubation requires both skill and patience, as it is a critical step in the induction process. After the tube is in place, post-intubation management begins. This phase is just as critical as the preceding steps, assuring the patient's stability and safety after the procedure. First and foremost, we must confirm the tube placement. This is vital, as misplacement can lead to severe complications. Auscultation of the chest and stomach is a common method, listening for breath sounds to ensure the tube has not been inserted into the esophagus. Visualization of chest rise and fall is also helpful. Additionally, end-tidal carbon dioxide detection can provide a reliable confirmation of correct placement. Once we are certain the tube is correctly positioned, it's time to secure the tube. This step is often underestimated, but securing the tube properly prevents accidental dislodgement, which could be life-threatening. There are a variety of devices available for this task, ranging from simple tapes to more sophisticated tube holders. Regardless of the method chosen, it should provide a firm hold without causing discomfort or injury to the patient. With the tube firmly in place, we now turn our attention to monitoring the patient's vital signs. Continuous monitoring of heart rate, blood pressure, and oxygen saturation is essential. These parameters give us insight into the patient's physiological response to intubation and anesthesia. Any significant changes could indicate a problem that needs immediate attention. In addition to these vital signs, it's important to keep a close eye on the patient's respiratory status. Regular assessment of breath sounds, chest movement, and the color of the patient's skin and lips can provide early signs of respiratory distress. We must also be vigilant for signs of complications such as aspiration, pneumothorax, or tube displacement. These can occur even with the most skilled intubation, so constant vigilance is key. In summary, post-intubation management is a multi-step process that includes confirmation of tube placement, securing the tube, and constant monitoring of the patient's vital signs. It's a crucial part of ensuring the patient's stability and safety after the procedure. Post-intubation management ensures the patient's stability and safety after the procedure. Now that we've walked through the process, let's summarize the key points. First, we discussed the importance of rapid tracheal intubation, a critical procedure in emergency medicine. The main goal here is to secure the patient's airway quickly and effectively, which can be a life-saving intervention in many situations. It's essential to remember that speed and efficiency are key, but never at the expense of safety. Next, we dove into pre-oxygenation. This step is all about maximizing the patient's oxygen reserves before induction. By filling the patient's lungs with a high concentration of oxygen, we can create a buffer zone that allows more time for intubation. This step is crucial because it can buy precious minutes, especially when the intubation process becomes challenging. Following pre-oxygenation, we discussed the role of induction agents. These medications are used to sedate the patient and suppress their protective reflexes, facilitating a smooth and rapid intubation. But remember, the choice of induction agent can greatly influence the patient's hemodynamic response, so it's important to choose wisely based on the patient's condition. We then explored the use of neuromuscular blocking agents. These drugs paralyze the muscles, including those involved in breathing, making it easier to insert the tube. However, they also carry risks, so it's important to monitor the patient closely during their use. The right choice and dose of these agents can drastically improve the ease and success of intubation. The intubation itself is a critical step that requires skill and precision. The technique used can vary depending on the circumstances, but the goal remains the same: to safely and rapidly secure the airway. The use of laryngoscopy, whether direct or video-assisted, along with the correct positioning, can significantly improve visualization and success rates. Finally, we talked about post-intubation management. After the tube is in place, it's crucial to confirm its correct positioning and secure it properly. Continuous monitoring of the patient's vitals and adequate sedation are also essential to prevent accidental extubation and to ensure patient comfort. To wrap up, it's important to note that each step in the process of rapid tracheal intubation plays a vital role. From pre-oxygenation to post-intubation management, each stage requires careful consideration and execution. It's also worth noting that these techniques and principles apply not only to emergency medicine but also to anesthesiology, intensive care, and other fields where airway management is key. Mastering these techniques can significantly improve patient outcomes in emergency situations. Remember, practice makes perfect, so keep honing your skills and stay prepared.